Good morning. Today we will see the remaining portions of medical surgical give reasons. The first question is, patient after lumbar puncture is nursed in flat. Why? As we all know, lumbar puncture is the incision on the spinal cord to take some CSF. So headache is one of the common complaint following lumbar puncture, and this headache can happen when some of the spinal fluid is removed. So lying down flat in the bed for several hours after procedure may help the headache to be less severe. That is why patient after lumbar puncture should be nursed in flat in bed. Second question, bowel wash to be given for the patients with hepatic encephalopathy. Hepatic encephalopathy is an altered level of consciousness as a result of liver failure. In healthy persons, the nitrogen-containing compounds from the intestine generated by the intestinal bacteria from the food are transported by the portal vein to the liver, where 80 to 90% are metabolized to the urea cycle and excreted immediately as a urea. But what happens in hepatic encephalopathy is the liver function will be impaired, so the urea cycle will not be very full clear, so there will be accumulation of what the ammonia will be the nitrogen containing compound, mainly the ammonia will be accumulated in the blood. So it will happen in the patients who is having hepatic encephalopathy. So this process is impaired in hepatic encephalopathy because of hepatocyte, that means the liver cells are incapable of metabolizing the waste products. Nitrogenous waste products accumulate in the systemic circulation, especially the product ammonia, and it is injurious to the brain. And most important waste product is ammonia, and this small molecule can cross the blood-brain barrier and cause brain edema. So, while giving a bowel wash, we decrease the generation of ammonia by altering the normal, washing out the normal intestinal flora. The conversion of the nitrogen containing compounds will not take place in the intestine. That is why bowel wash should be given in the patients who are having hepatic encephalopathy. The third one, haemarthrosis is often seen in patients with haemophilia. Haemarthrosis is a condition of articular bleeding, that means the bleeding into a joint cavity. And haemophilia is usually an inherited bleeding disorder in which the blood does not clot properly, and this can lead to spontaneous bleeding as well as injuries following surgery. Haemarthrosis are the most common cause of progressive morbidity in haemophilia. Bleeding into a joint space may occur in the absence of non-trauma in patients and severe disease. The joint commonly include our knees, elbows, and ankles. So haemarthrosis occurs in patients with hemophilia because hemophilia is a condition in which the bleeding disorder or the blood will not clot. So a slight injury a slight injury to a joint can cause haemarthrosis in patients with hemophilia. Sensor of the pulse oximeter is the patient placed on patient's nail. Why? Usually we have seen the sensor of the pulse oximeter kept on the thumb of the patient. So pulse oximeter is a non-invasive test that measures the oxygen saturation level of the blood. The most common approach is transmissive pulse oximetry. In this approach, the sensor device is placed on a thin part of the patient's body, especially in a fingertip or an earlobe or an infant's foot. The fingertips and earflow have higher blood flow rates than other tissues, which facilitate the heat transfer, and we will get an accurate result of the oxygen concentration of the blood. That is why the pulse oximeter is kept on the patient's nail. Oral feed contraindicated immediately after upper GI endoscopy. During an upper endoscopy, a digestive tract by the gastroenterologist uses a scope to view the inside of the esophagus, stomach, and duodenum, which is the upper part of the small intestine. Doctors use procedure to diagnose and treat acid reflux, stomach ulcers, celiac disease, gastrointestinal disorders, and other digestive tract problems. So, maintaining an NDO status after the procedure until the anesthesia will warn off the gag reflex has been returned. That means when we give the oral feeds are given, because usually before endoscopy we'll give a mild sedative to the patient, or anesthetic drug will be given to the patient. So sedate, that means mild sedation for the patient. So when the sedation has been given, the gag reflex will not be function properly. Without functioning the gag reflex, if we give something orally, it may cause the aspiration pneumonia. That is why the oral feed is contraindicated in the patients immediately after following GI endoscopy to decrease the risk of aspiration. Client with ascites need to be placed in fowler's position. Ascites is a pathologic accumulation of fluid within the peritoneal cavity, which is the most common complication of cirrhosis of liver. Supine position with the head elevated to 30 to 45 degree will alleviate the symptoms of the patients because an enlarging abdomen may cause some tension of the diaphragm, and it may decrease the space available for the lungs to expand and may cause breathing difficulty. In supine position, the tense ascites result in increase in lung elastic rod and development of positive end expiratory pressure, which constitute overload and increase activation of the inspiratory muscle. So the patients who is having ascites, when they lie flat on the bed, the ascitic fluid they compress on the diaphragm, and which will decrease the space available for the lung to expand. So when we take it, so the patient may suffer from some amount of shortness of breath or breathing difficulty. So when the patient is lying on the supine position, it may easy for the pressure of this ascitic fluid on diaphragm will be relieved and the lung can expand normally. So the patient will be relieved of, or patient will be feel better when they are in a fowler's position. High protein diet encourages child with nephrotic syndrome. Nephrotic syndrome is often caused by damage of small blood vessels in the kidney that filter the waste and excess water from the blood. So normally the protein is reabsorbed from the kidney. It is never excreted in the urine. But because of the kidney damage or the cells of the kidney damage, too much protein is lost in the urine, which is known as proteinuria. So low level of protein called albumin in the blood called hypoalbuminemia, that which cause the oncotic pressure will be decreased and swelling in the other part of the body, which is called as the edema, which is a common symptom of a nephrotic syndrome. So in nephrotic syndrome, because of the tissue damage of the kidney, the kidney is not able to reabsorb the protein from the waste material. So while the protein will be lost, which is known as proteinuria, and the low protein amount in the blood is known as hypoalbuminemia, which further decreases the oncotic pressure and cause edema. So a diet that is moderate protein can help to reduce the amount of protein lost, can compensate whatever amount of protein lost in the urine, and preserve the kidney function. Sodium restricted diet in hypertension. Too much sodium causes the water to retain. This in turn increases the fluid in the body, which in turn will increase the blood pressure. So it is better to have a sodium restricted diet in hypertension to control the blood pressure. Patients should be NPO status before gastroscopy. Gastroscopy intended goal to reduce the morbidity and mortality rates from pulmonary aspiration that may rarely occur as a complications of gastroscopy. Ensuring that food is available before the insulin administration. Insulin is a rapid acting hypoglycemic agent which helps to reduce the blood sugar level. Insulin starts to work rapidly in the bloodstream. If the patient waits too long to eat, the blood sugar can get too low. This puts the person at the risk for hypoglycemia. That is why we should be, before giving insulin to a patient, we should make sure the patient can eat after the injection. So if the patient has to wait for 1 or 2 hours for the food, then it is better to give just before the food, because to prevent the patient from hypoglycemia. Thank you for listening.